Welcome everybody, and thank you for attending today's webinar. This is the final one for 2017, and we'll be picking up the sessions again in February of next year. So please look out for our newsletter. Our guest speaker today is Robbie Bedbrook, and Robbie is a registered nurse with a passion for health promotion and social justice. Robbie works predominantly in primary health care with a special interest in sexual health, mental health, and managing chronic illness. In 2016, he founded the health promotion channel Hot on Health, which seeks to use video content to improve rates of health literacy and promote the underdeveloped and underrepresented field of primary healthcare nursing. In 2017, Robbie was named a finalist for Recently Graduated Nurse of the Year by the Australian Primary Healthcare Nurses Association. Since then, he has been working hard towards becoming a nurse leader in the field of primary healthcare through various consulting roles with local government bodies and universities. So welcome, Robbie, and thank you so much for volunteering your time today.
That's all right. Thank you so much for having me. That was the nicest intro I've ever gotten ever, so I might just get you to follow me around all the time. Okay, thank you very much, Sarah. Thank you for having me. I'm very excited, a little bit nervous as well to be talking to everybody today. As Sarah said, my name's Robbie. I'm a registered nurse. I work in primary healthcare predominantly, and I'm going to talk to you a little bit today about social media, increasing technology, and its impact on patient education and primary healthcare in general. So this is just a little layout of what I want to cover today, or what I'm going to try to cover. I'll talk briefly about health literacy, because I don't think you can really talk about patient education without understanding the context of where we are in Australia with health literacy at the moment. I'll talk about the impact technology and social media is having on healthcare and patient education, how we can embrace technology and social media to get better patient outcomes rather than negative patient outcomes. And that's where I'll talk a little bit about my work, Hot on Health, as well. And then I will also touch briefly on how primary healthcare, I think, is the field of healthcare that can really be leaders in change when it comes to technology and social media. And I'll hopefully shed some light on how we can achieve that. I will just stress now, I do not sit here and pretend to be sort of the be-all and end-all expert on social media and its impact on health. I don't have a doctorate in social media or anything. Most of my experience comes from my professional experience working with patients who regularly engage with social media, my project that I've been working on for just over a year, and also, I guess, the research and study I've done into using social media myself. As Sarah said, if you have any questions, I am very big on feedback, positive and negative, so please pop them into the chat section during the talk and I will try to get to them at the end. Or you can always, I'll put my email at the end so you can email me some feedback or a question if you'd like. All right, so the first thing I'm going to talk about is health literacy and sort of where it stands at the moment, because you can't really talk about patient education and how it's changing without understanding health literacy. At the moment, rates of health literacy in Australia, individual health literacy, are not amazing. The Australian Commission for Safety and Quality in Healthcare estimates that about 60% of Australians have low individual health literacy. This isn't a great statistic to look at. It feels a little discouraging, but what I do want to stress is that this is not a new phenomenon. So it's not like technology's risen, social media's risen, and that's kind of plummeted our rates of individual health literacy. This is actually a fairly stable statistic that we've been dealing with for quite a long time. I say that because social media and technology definitely can have an impact on health literacy, but as it stands just yet, it hasn't really tipped the scales one way or the other. So when we're talking about health literacy, oh, I can see someone on their camera. Barb, hello, Barb. So when we talk about health literacy, what exactly do we mean? Because it is sort of quite a difficult thing to tackle and sort of wrap your head around. I think of, or you guys can keep your camera open if you want. It's probably nicer to look at, more interesting than my presentation. I think of health literacy as very broad. So obviously it's how patients understand and engage with information that we give them. Can they retain it? Can they repeat it? Can they use it? But health literacy, I really think, infiltrates and impacts every moment of every day of people's lives. It's not just about, do they know the name of their medication and their dosage, as opposed to, oh, I take 2 purple pills around lunchtime, I don't really know. It's also about, do they understand basic things like, if I get a patient in the treatment room for a B12 shot, do they know what B12 actually means? Do they know its long-term implications with deficiency, or do they just know they don't have a lot of it? When people go traveling and they get vaccines, do they know why they're getting vaccines? Do they know what they need those vaccines for, how that disease process works? And then even outside the clinic, do people know what bulk billing is? Do people know what gap payments are? Do people know you need different STI checks depending on who you sleep with? I mean, health literacy, it doesn't really surprise me that our rates are so low because it's such a broad area with so much to know and understand. And with the freeze of Medicare rebates and the rise of 6-minute medicine, this will just sort of continue to have an impact, and we need innovative platforms to bridge this gap. And I do think social media can be one of those innovative platforms to start improving our rates of individual health literacy. So I'll talk now about the changing landscape of technology recently. My other title for this slide was Who Remembers Video Stores? Because we live in what might be one of the greatest technological booms in history. In no other period of time has technology advanced so rapidly. I mean, you can get one invention and then you blink and all of a sudden it's obsolete and it's been replaced by something newer, shinier that can do 20 more things than that thing could. And that's very, very exciting, but it is also quite overwhelming because it means that we as healthcare workers need to keep up with this change that is happening rapidly in real time. And I just want to demonstrate this for a very short little demo, just about how much technology has shifted in my lifetime. I remember very fondly as a kid VHS, which I'm sure we all do, and going to the video store and how annoying it was when you went to the video store and someone hadn't wound back the video. I remember getting my very first Walkman, which was quite a big deal, which was soon to be replaced by my very first Discman. And we look at this timeline of mobile phones and how it was, you know, these were all the rage, sort of 92, the big brick phone. And we look at this now and it looks antiquated compared to our smartphones, but that wasn't that long ago. Of course, the iPod revolutionized music, DVDs replaced videos, which replaced Blu-rays, which now we just have Netflix. Of course, we have smartphones, which can do literally everything for us, including a lot for our health. And even smartphones now are starting to become replaced by smart watches. These are just watches that we can wear, which can make phone calls, send text messages, measure our heart rate, tell us when we're going for a run, play music. I mean, and this is just in, you know, in nearly 30 years, just how rapidly technology's changed. And I just emphasize that because it's happening really fast. And so it's something that we want to be ahead of rather than trying to constantly play catch up. I mean, look at us now having this webinar via technology. It can do amazing things. So this is just a general overview of the rates of social media usage in Australia and also a little bit globally as well. And the reason that I put this up here is because social media is not a trend, it's not a phenomenon, it's not going anywhere. You can see from these statistics that social media is very much the world that we live in at the moment. You know, 70% of Australians use Facebook. At least half of us are going to watch one YouTube video today, if not more. Nearly 2 billion people use Facebook. Nearly every Australian can access an internet-enabled device, and most of us use our smartphones for app usage. I mean, it just sort of, it does bother me a little bit when people say, and I'm sure I've been guilty of this, oh, you know, social media, it's not the real world. You know, we want people to go out and engage with the real world. And I'm much more of a fan of kind of getting up, you know, going for a walk, engaging with nature, getting outside. But that's no less of the real world, unfortunately, anymore than social media. It's here, it's real. This is the world happening in real time for the majority of the global population, especially in Australia. And so we need to figure out how to engage with it and how to embrace it and how to use it in moderation as well. So following on from just the rates of social media usage in general, this is sort of specifically how it relates to healthcare as it stands and the whole Dr. Google phenomenon. So 1 in 20 Google searches are for health-related information. This is pretty staggering considering the amount of things that you probably think about that you yourself have typed into Google and that you know that we Google search every day. A lot of people are turning to the internet for health information. And you can see from one of those stats that a lot of people under 35 are turning to the internet to avoid accessing healthcare systems if they think they can. And I'm not saying that this is positive or negative, I just don't know if it's being done particularly well, but it's definitely a real trend and a real phenomenon. Google actually recently invented a health tab or health bar because it knew that there were so many health-related searches. So they wanted to provide people with quality information. So if you search certain words on Google, you'll see a designated little health tab pop up. Like if you type the word tonsillitis into Google after this, you'll see the health bar pop up on the right-hand side of the screen. It'll show you symptoms, treatment, what to do, when to access seeing the doctor, and it's all information that's vetted by about 10 healthcare workers or something like that, which is amazing because it means they're providing quality information, but is it also going to discourage people from accessing primary healthcare? I think there's a debate for both, and we just need to figure out how to use both of them or use them in conjunction. But as you can see from this, it is impacting healthcare and it's very real. And unfortunately, that bottom sort of statistic shows that healthcare doesn't have a great reputation for using technology and social media. Only the oil refinery business, I think this is a US statistic, but falls behind healthcare in digital media uptake and usage. We're often a bit slow with technology in healthcare, I think I can boldly say. Partly because health is very complicated and individual, and it's very hard to create software that applies to every health need and condition. And also, I think, obviously, the legal ramifications of privacy violation and posting things online is something to really consider and think about. All right, so those are the kind of stats. That's sort of where we sit in terms of using social media. But what does it all mean for healthcare? Is it really having an impact? Is it not? The answer is, unfortunately, quite vague. Social media is not really the problem when it comes to health literacy and patient education, but how we use social media is the problem. So there's nothing wrong with social media. It's been proven to have really positive health outcomes for some people, but it also has been proven to have very negative health consequences for some people as well. The research is very conflicting. You'll read one paper and social media looks like the best thing in the world and I'll get every patient on it. And then you read another thing and you go, oh my God, I'm going to shut down every computer in my clinic. But generally you just see similar themes conflicting. So, is social media increasing patient autonomy because we can access more information online? Or is it spreading the misinformation because anybody can write a website and say whatever they want to say and it doesn't need to be vetted? You just look at, the myth and the myths that still persist around vaccination, and a big part of that is spread through social media. Some research argues that it increases collaborative consults and patients and doctors can work on their issues together doing research, but then other research says that it's actually negatively impacting the doctor-patient relationship and it's decreasing respect for the healthcare system. Because in the consumer-centered world of having clothes delivered to you through your smartphone and food and everything being done for you, people want healthcare to follow that trend, and that's not exactly how it works. Social media is excellent for responding to epidemics and pandemics in healthcare. The World Health Organization can tweet out real-time remedies and responses for healthcare outbreaks, and that is phenomenal for improving patient outcomes. But then, of course, it can have the opposite effect. During the Ebola outbreak, someone tweeted that if you drink salt water, it will reduce your likelihood of getting Ebola or it taking your life. And that information took hold on some people. It ended up killing 2 people and over 12 people were hospitalized. And so again, you can just sort of see from all of this, it's not really the entity that's the issue, but it's how we engage with it. And then the big one, of course, is about mental health. So does social media connect us and inspire us, and can we advocate with it, or does it isolate us and make us anxious because it's a bit addictive and we're sort of comparing ourselves to everybody constantly? I don't exactly have all the answers on this, but I'm sort of trying to do my part to improve patient outcomes and embrace this technology and social media to improve health outcomes and make it better for patients. I will say all the research, as conflicting as it is, does emphasize that moderation is key when it comes to social media. So, you can use it and use it really well and teach your patients how to use it well, but it's never going to solve all their health problems, obviously. They have to engage with primary healthcare as well and sort of get outside and do everything. All about balance. So my very small contribution to trying to embrace social media and technology is the project I started just over a year ago called Hot on Health. It's a very, very simple concept, Hot on Health. It's a tool for health promotion. So I used to see a lot of patients at work who would ask me the same kind of questions over and over again. And I sort of got to a point where I thought, I really thought this was information that we all should know, or at least know how to access. And I sort of had a light bulb moment and thought, well, maybe I could start writing some content online and sharing it with people. And so basically what Hot on Health is, I create videos and articles which I share via my website and social media about common health issues, clinical issues, as well as, you know, societal issues as well, which I'll go into sort of briefly and soon. It's very simple. It's all kind of really easy to understand information. But the main thing that I stress and emphasize through Hot on Health with all my video content is that it's all evidence-based information. Obviously, I'm a registered healthcare worker, so it's coming from a reliable source. And I also share all of the information or all of the research that I use to create this content with patients as well. Because I think for me, the best way to improve health literacy isn't just to bombard people with information and sort of tell them what to do, but to involve them in learning how to access that information themselves. So I'll just give you a little demo of what Hot on Health sort of looks like. I wanted it to be really bright and vibrant and colourful. And in general practice, where I work predominantly, you engage with a lot of different topics. So I've done content on acne, because we see a lot of people for acne treatments, on the flu vaccine, on building your own first aid kit. But then I expand outside clinical issues and I teach people, you know, what's a mental health care plan? Are you entitled? How do you access it? Wound care, I talk about bulk billing, because I think a lot of people don't actually understand why gap payments are increasing and they're annoyed that they have to start paying for the GP. But if they really understood the core reason, then they'd probably be a little more okay with it. I talk about consumer-centered healthcare. I mean, this is just a bit of an overview to give you an idea of what it looks like. I do a lot on sexual health. I read yesterday that rates of gonorrhea have gone up by about 63% in 10 years in Australia. So I do a lot of sexual health content because that's an area that's growing. I went out on the street for a few videos and kind of interviewed people in my community about what health meant to them. But the main crux of it really is that it is easy to understand information that looks bright, looks vibrant, something you want to engage with. If it's scrolled through on your news feed, you're going to want to watch that and learn something rather than a video on, like, I don't know, what the latest Kardashian did or didn't wear. And then the other sort of side reason that I created Hot on Health, aside from trying to just teach people about common health issues, is to promote primary healthcare and primary healthcare nursing. I just am incredibly passionate about primary healthcare. I think it's one of the most phenomenal, amazing fields of healthcare that can have such a big impact on people's lives and create real behavioral changes. So the theme of every video essentially is, cool, here's some information that I've taught you, but now take this to your doctor, to your healthcare worker in primary healthcare, engage with them, and then use the services because they're there for you. And we know, you know, rates of lifestyle preventable diseases are on the rise, chronic illness, certain chronic illnesses on the rise. We see people in the community in primary healthcare when they're as well as they can be, or they've just been discharged from hospital, when they're actually able to be taught things and molded and create behavioral changes. And then, of course, I wanted to advocate for primary healthcare nursing because I'm a primary healthcare nurse, and I think this field of nursing is often viewed as a bit of a step down. A recent report from APNA showed that not just sort of the general public, but other nurses, other healthcare workers view this area as a step down compared to other fields of nursing, which I think if anyone works in the full scope of their practice in primary healthcare or has seen someone doing that, you know that that is rubbish because it's quite complicated, quite challenging work, and it's very autonomous as well. I've got those two little pictures there as well from Grey's Anatomy and Nurse Jackie, because a lot of what we see in the media about nursing is not always super positive, especially when it comes to TV and movies. You don't see a lot of the work they do, and they're often super promiscuous, or they aren't that intelligent, or you just never see them essentially. And so I really wanted to create a project that showed people that nursing is a very kind of well-rounded field of healthcare. You need, you know, to be autonomous and independent, and you have to research. And I really just wanted to create a seat at the table for nursing in primary healthcare when it comes to writing policy, making big changes in health literacy and patient education. Of course, there are concerns to think about when it comes to posting any information online and using social media. And these are what I think the big ones are, in case anyone obviously is thinking about risk or concerns. Privacy is the big one when it comes to healthcare. We cannot and should not share any kind of patient information. So none of the content that I share is personalized or tailored or bespoke. It's just general guidance, and they're not specific consults for people. They're just either topics that people sent in because they were interested or things that I've seen at work. If you are online and you are engaging with social media, of course, you do run the risk of people, writing negative comments and trolling you, but you just develop a bit of thick skin for that, and it's mostly just attention seeking. But I think it's important to highlight that there are things to consider and concerns when using social media for health. But these are only issues because I don't think we as healthcare workers have ever properly been trained and shown how to use social media. Most of what I got taught about social media at uni was very negative. It was just, do not use it, do not engage with it. It's going to damage patients. You're going to damage your career if you use it. And so I sort of initially switched off to the idea. And so I never thought to engage with it properly. But I think if it was almost a unit at uni, or people were shown, there were in-services at work and we were kind of taught how to use it well, then we could have more positive patient health outcomes than negative, or just avoid the whole sphere of social media because our patients are using it and we kind of want to learn it well and beat them to it, essentially. So if you are interested in any of the work of Hot on Health, this is how you access it: website, social media. I'm very, very open to feedback, especially from healthcare workers, because I mean, you're working with patients and so you know what is going to help them and isn't. So my email will be at the end of this presentation. So please, if you have a look, send me any advice. If you watch any of the videos or read any of the articles that you have, I will absolutely take it on board. So I'm very much not alone in uptake of social media, not by any chance. So these are just a few sort of very prominent examples. There's a US doctor called Dr. Mike who had a social media presence, and he's now founded a healthcare charity. I don't know if anyone knows Alison Fairley. She's a mental health advocate and health promoter in Queensland. She works with rural and remote communities. And through her blog and social media presence, she sort of advocated for mental health and accessing mental health services. Obviously, Emma Watson, a lot about feminism, gender equality, and accessing better healthcare for women. Michelle Obama and the Fitbit revolution. But of course, these are sort of fairly prominent figures, but I do just want to show for this last one that social media is not limited to young people, and is not, it's not limited to a particular demographic. This is a group from the Northern Rivers in New South Wales called the Knitting Nanas, who were dissatisfied with the coal seam industry's impact in their area. And they took to social media, created a presence, and it's now become global, and they've received support from all over the world. So when you're thinking about social media and healthcare, it absolutely is not just about your patients under 35. People can engage with their fitness apps, with social media, with the internet to find good quality information from any age onwards, as long as we show them how to use it well. So the last thing that I'm going to touch on very briefly is how we can start to make these changes, and what everyone listening here can hopefully take from this presentation, and what you can do with your patients or with your practice moving forward, just to start to understand social media a little better and its impact on health, and how to teach patients how to use it. So there are sort of lots of examples. I won't go into them in too much explicit detail. I hope that control panel's not cutting that off too much. I'm definitely not saying that every single healthcare worker should create an online presence and become sort of a mini pseudo health promoter. That's definitely not realistic and not what I think should happen, but there are things that you can do. So if you are a practice manager, or can make an influence in the practice you work in, you can create a social media presence, but only if you have time to invest in this. That was the one thing I would say. If you're going to take to social media and sort of create a presence for yourself or your practice, you have to go at it 100%. I always think there's nothing sadder than like an abandoned Facebook page where the last post was from 3 years ago, and you just sort of can see that it hasn't been sort of attended to, and your patients will see that too. Hold in services, bring in consultants and experts and people who create apps or know how to use them or use them regularly to sort of teach your staff about how to get patients on board using them. That's a big one. You yourself, just start playing around on your smartphone. There are fitness trackers, pedometers, health apps built into our smartphones. And if you just play around with them with your own stats, you can then start teaching them to patients. And there are a million amazing apps as well. So new parents, make sure they get the vaccination reminder app, which is sponsored by New South Wales Health here in New South Wales. Obviously, I think there's state ones all around Australia. There's medication reminder apps. If you have any patients who just have terrible adherence, then they can download an app which can connect to their phone or their watch, which will remind them at the right times every day. Start to become familiar with wearable technology, which is like iPhone or iWatches rather. So These are amazing sources of data that we can use to track our patients' healthcare, essentially, because it's measuring their heart rate, fitness constantly, and you can use that if they start to present with an issue. Find your favorite websites that you go to for health information, like the Centre for Disease Control or Better Health Channel in Victoria, and teach your patients how to do that research so they can bring it in and you can go through it together. And then my big advice would be to engage with other healthcare workers via social media, especially on Twitter. You don't have to be tweeting all the time. I mostly use Twitter just to follow other healthcare workers and get access to amazing resources I might not have found otherwise. And finally, just ask your patients about their social media usage, especially when it comes to mental health. If you're working with anyone and they're expressing feelings of anxiety, depression, isolation, talk to them about their social media usage and find out whether they're oversaturating, they're comparing, or maybe they can find platforms on social media, health promoters, advocates, people like Alison Fairley, who they can start to connect to and feel less isolated. All right, so that is pretty much it for me today. Thank you very, very much for everybody who attended the webinar, who listened. If you do have any questions, please type them now, and I will do my very best to answer them, although I'm sure you're probably quite sick of the sound of my own voice, which is absolutely fine. My email is just down there, so if you do have any questions at all, or you want to send through any feedback, please do. I would very much appreciate any tips, advice on Hot on Health, or if you just want to find out more about how patients can use social media positively, I'll happily answer those questions too.
So Robbie, thanks so much for that. I do have a question from Megan. She asked, do you have any suggestions with regarding measuring health literacy?
I do, absolutely. So I suppose there are tools that you can access online, which is basically like questionnaires, but I suppose my tip would be to look at the person in context. So if there's someone who takes regular medication, start with the health information that they're engaging with regularly. So do they know the names of all their pills and their dosage and what time they take them? And that's how you start to see, and you kind of build up from there. And okay, do you know the side effects of that? Okay, do you know why you take it? But if there's someone who's generally who presents fairly well and doesn't have regular medications or doesn't need to access services regularly, then I would just start with the more broader questions. You know, do you know what bulk billing is? Do you know what gap payments are? When was your last STI check? And just find out kind of those more broad societal health questions that they might not have thought to engage with. But there are excellent online questionnaires that you can find which go through sort of rate person's health literacy, and the Australian Commission for Safety and Quality in Healthcare has a lot of those tools and resources.
Okay, great, thanks. And Katie has asked, do you use the patient enablement and satisfaction survey, and is there an online version?
For an online version, I suppose I would again turn to the Australian Commission for Safety and Quality in Healthcare. Any of my best resources for health literacy I have found through them, so I would sort of troll and search through all of their online resources. We at the practice do use the patient enablement and satisfaction survey, and I have always wished there was an online version. But yeah, I do use that. But again, I think I don't know. I find it a bit of a limiting tool. Like, it's very, very good and it works for some people, and then you sort of do it with others and you can see that it doesn't work that well. But I would head to the Australian Commission for Safety and Quality in Healthcare for online resources in that field. And there's also great videos on YouTube about health literacy that can play in waiting rooms as well.
Awesome, thank you. Well, that looks like all the questions. Oh, here we go. So I've just got a comment from Michelle. Health literacy also involves the clinician being health literate as well. So for example, the language they use and their knowledge and understanding of local care pathways, including referral processes.
That is an incredibly brilliant comment, Michelle, because I think part of what I found most frustrating when I started working, or when I first graduated, was it wasn't just about teaching patients, it was also about teaching myself and teaching those around me as well. Because if you don't know the best way, I mean, I've worked with GPs who will just send referrals to hospitals because they know there's a specialist there, and they'll just write, "Dear specialist," and then it just gets sent off into the ether, and that patient's not going to get the best care. And sexual health, I've had to do a lot of in-services for GPs about how to order the right tests and use the right language with patients so that they know you're actually talking about sex, because we get a bit awkward about it and we use weird jargon and they don't know what you're actually asking. But that's an excellent point. A big part of health literacy is us realizing that we're not perfect and the the be all and end all when it comes to health and being open to learning more and new things, which social media and Twitter are excellent for at finding other resources through healthcare workers.
Excellent, thank you. So thank you so much, everybody, for attending today. I don't think we've got any more questions. Now, one of the great things about technology is I'm aware that you've all seen this control panel, but we have a guy here who's a bit of a guru with videos. So when we edit this, hopefully we'll be able to get rid of it and we'll be able to offer a nice clean screen, and then we will upload it onto YouTube, and I think Robbie might pop it on his channel as well. So yes, please look out for that, and I'll send a link to everybody who registered today to have access to that, and please feel free to pass that on. So Robbie, thank you so much for today. That was just excellent and fascinating and so relevant as well. So I'm just so pleased that you were able to join us today.
No, that's okay. Thank you so much for having me. I forgot to click through to my next slides, which are all the references and resources that I used today to talk, but they'll all be on YouTube. So if you want to follow any of that up, it'll all be on the references on YouTube. But thank you so much for having me. It was really great to talk about this.
Oh, thank you. So please, everybody, when you log off today, an evaluation form will pop up, and in the for our quality improvement, we do ask that you do fill out the evaluation form and give us feedback, because we're always trying to improve these. We've also included a section which asks people for some suggestions. So what would you like to hear on qiCommunity? And we certainly will take that on board as well. So again, thank you. Again, it's the last one for the year. I can't believe we're already at the end of 2017. We hope you all have a safe and wonderful holiday, and we'll see you next year.